Welcome to the Senior Health video. This video will talk about 12 silent pancreatic cancer warning signs you must not ignore. Have you been noticing small changes in your body that you keep trying to rationalize, telling yourself they are probably nothing? Many people do this every day, brushing off discomfort, fatigue, or unusual digestive issues without realizing that the body often sends quiet warnings long before a serious problem appears. You deserve clarity, and you deserve to understand what your body might be trying to tell you. That is why this moment matters, because what feels minor today could be connected to something far more important than you imagine. The reality is far more urgent than most people realize. Pancreatic cancer is one of the deadliest cancers in the United States, and it often develops with almost no obvious early symptoms, allowing it to grow silently until it reaches an advanced stage. This hidden nature makes every overlooked signal potentially significant. What makes this even more alarming is how easily the early signs can be mistaken for everyday issues that millions of Americans experience. When a disease this serious can disguise itself behind symptoms that appear harmless, awareness becomes not just helpful, but absolutely essential. Yet even with the seriousness of this condition, there is real hope, because knowing the right warning signs can dramatically improve your ability to recognize something is wrong. Awareness gives you more than information. It gives you confidence. It gives you control. It gives you the power to act early when it matters most. As you continue watching, you will learn the key symptoms that deserve your attention, the subtle shifts that people often ignore, and the reasons these signs can become life-saving when understood correctly. By the end of this video, you will know exactly what to look for and why these early signals matter so much, allowing you to protect your health with clarity and confidence. Number 1, unexplained weight loss. One of the clearest and most concerning early signals is unexplained weight loss, especially when you are not trying to lose weight or changing your routine. When pounds begin to drop without effort, your body is telling you something important. The pancreas plays a key role in digestion, so when it is disrupted, your body cannot break down food properly, leading to weight loss, even if your appetite feels normal. Many people in the United States mistake this for stress or aging, but research shows that a large number of pancreatic cancer patients report sudden weight loss early in the disease, often before any other symptom appears. This happens because tumors can block digestive enzymes, making your body burn energy inefficiently and leaving you feeling weaker and more tired. If you notice your clothes fitting differently or the scale dropping for no clear reason, it is time to pay attention and get checked. But knowing this sign alone is not enough, because the next warning can be even easier to overlook. Number 2, abdominal pain. Another powerful warning sign you should never ignore is persistent abdominal pain, especially when it sits deep in the upper belly or seems to reach into your back. This type of pain often feels dull, steady, and strangely familiar, making many people think it is just indigestion or something they ate. But when the pancreas is under stress, the pain can become more noticeable, because the pancreas sits in a sensitive area surrounded by nerves and vital organs. When a tumor begins to grow, it can press on these structures and create a discomfort that does not go away easily. Many Americans try to manage this pain with common remedies, like antacids or rest. Yet research shows that a large percentage of pancreatic cancer patients report abdominal or back pain long before the disease is diagnosed, which makes this symptom far more important than most people realize. When pain becomes persistent, when it returns day after day, or when it slowly intensifies, your body is signaling that something deeper may be happening. Ignoring it can delay the chance to catch a serious issue early. If you feel a constant ache that does not improve or keeps coming back, it is worth getting checked, even if it seems small. But only understanding this sign is not enough, because the next warning can be even more subtle and far easier to dismiss. Number 3, jaundice. One of the most striking warning signs you should never overlook is jaundice, which shows up as a yellowing of your skin or the whites of your eyes. This change can feel shocking because it appears so suddenly, yet many people still try to explain it away as fatigue, stress, or a simple digestive issue. In reality, jaundice happens when bilirubin builds up in your bloodstream, and that usually means something is blocking the normal flow of bile. The pancreas sits right next to the bile duct, so when a tumor begins to grow, even a small amount of pressure can disrupt the movement of bile and cause bilirubin to rise. When this happens, the yellow tint becomes a clear message your body wants you to notice. Some Americans first spot jaundice when they see darker urine or lighter stools, and studies show that a large percentage of pancreatic cancer patients experience jaundice as one of their earliest visible symptoms, which makes it a powerful alert that something deeper may be happening inside your body. When bile cannot flow properly, it affects your liver digestion and energy levels, creating a chain reaction that should never be ignored. If you ever see unusual yellowing in your skin or eyes, or changes in your urine or stool color, seeking medical attention quickly can give you answers before the situation becomes more serious. But knowing this sign alone is still not enough, because the next warning can appear quietly and become even more dangerous if you miss it. Number 4, nausea and vomiting. Another critical warning sign you should pay close attention to is persistent nausea or vomiting, especially when it appears without any clear reason. Many people assume an upset stomach must be related to something they ate a stressful week or a minor stomach bug. But when this feeling returns again and again, it can be a sign that your digestive system is struggling. The pancreas produces essential enzymes that help break down fats, proteins, and carbs. When something interferes with this process, your stomach may empty more slowly, causing nausea, discomfort, or unexpected vomiting that refuses to go away. This becomes even more important when you realize that a significant number of pancreatic cancer patients report nausea as one of their early symptoms, often appearing when a tumor blocks the flow of digestive juices or presses against nearby organs. As the digestive system becomes disrupted, food may sit in the stomach longer than it should, creating a constant feeling of fullness that leads to nausea. Some people also notice that the nausea worsens after eating, which is a clear sign something inside the digestive tract is not working the way it should. If you find yourself waking up nauseous or feeling sick after normal meals, it is worth getting checked so you can understand exactly what is happening in your body. But only recognizing this symptom is still not enough, because the next sign can quietly affect your daily routine in a way that is even more concerning. Number 5, loss of appetite. One of the most subtle yet powerful warning signs you should pay attention to is a sudden loss of appetite, especially when you normally enjoy your meals and have never struggled with eating before. When the pancreas begins to face stress or disruption, your digestive system cannot process food the way it should, and your appetite can drop without warning. Many people try to blame this on a busy schedule or emotional stress, but when you consistently feel full after only a few bites or lose interest in foods you used to enjoy, your body is signaling that something deeper may be happening. This becomes even more concerning when you understand that a large percentage of pancreatic cancer patients report appetite changes early in the disease, often long before they notice pain or fatigue. When tumors affect the flow of digestive enzymes or interfere with hormones that regulate hunger, the body can become confused about when to eat and how to use food for energy. This not only disrupts your normal eating patterns, but can also contribute to rapid weight loss and increasing fatigue, creating a cycle that becomes harder to ignore over time. If you notice that eating feels like a chore, or you feel full unusually fast, it is important to get evaluated so you can understand what your body is truly experiencing. But just being aware of this sign is still not enough, because the next warning can appear even more suddenly and raise concerns that are impossible to overlook. Number 6, new onset diabetes. Another warning sign that deserves your full attention is the sudden development of diabetes, especially if you have never struggled with blood sugar issues before. Many people are shocked when they receive a new diabetes diagnosis because they assume it must be related to diet, age, or lifestyle. But the pancreas is the organ responsible for producing insulin. So when something disrupts its normal function, your blood sugar levels can rise without warning. This is why a sudden shift in your glucose numbers should never be overlooked. It can be the body's first attempt to signal that something deeper is affecting the pancreas. This becomes even more important when you learn that a significant number of pancreatic cancer patients develop new onset diabetes shortly before their diagnosis, which makes this sign incredibly valuable to recognize early. When tumors interfere with insulin production or damage the cells that regulate blood sugar, your body struggles to keep glucose under control. You may experience increased thirst, frequent urination, unexplained fatigue, or blurry vision, and many people do not connect these changes to pancreatic health. This misunderstanding often delays medical attention during a time when early evaluation is crucial. If you or someone you know suddenly develops diabetes without any clear risk factors, it is essential to speak with a healthcare provider so they can determine what is truly happening inside the pancreas. But even understanding this sign is not enough because the next warning can drain your energy in a way that is far more disruptive than most people expect. Number 7, unexplained fatigue. One of the most draining and easily dismissed warning signs is unexplained fatigue, a deep tiredness that lingers no matter how much you rest. This is not the usual end-of-day exhaustion or the kind of tired feeling that comes after a busy week. This is a heavy, persistent fatigue that makes simple tasks feel overwhelming and steals your energy without warning. Many people blame this feeling on age stress or poor sleep, but when your pancreas is under strain, your body begins to burn energy differently. It can no longer use glucose efficiently, and that shift leaves you feeling depleted even after a full night of rest. This becomes even more concerning when you realize that a large number of pancreatic cancer patients report extreme fatigue early in the disease, long before more obvious symptoms appear. When cancer cells grow, they consume a significant amount of your body's energy, and your immune system works overtime trying to fight back. This combination creates a powerful wave of fatigue that does not improve with rest. For many Americans, this becomes noticeable when daily activities start feeling harder or when they lose motivation without knowing why. This type of fatigue is often the body's way of asking you to look deeper. If you find yourself constantly drained for no clear reason, it is important to take the symptoms seriously and speak with a healthcare professional. Early awareness can make a meaningful difference in understanding what your body is truly experiencing. But noticing your energy levels is only part of the picture because the next sign can appear in an unexpected place that most people never think to connect with the pancreas. Number 8, pale or greasy stools. A surprisingly important warning sign that many people overlook is the appearance of pale or greasy stools, especially when they float or leave an oily residue in the toilet. This change may seem embarrassing or easy to ignore, but it offers a direct window into how well your pancreas is functioning. Under normal conditions, your pancreas releases enzymes that help your body break down fats. When that process is disrupted, fat cannot be digested properly, and it passes through your system unchanged. The result is stool that looks pale, bulky, or greasy, and this is a signal you should never dismiss. This warning becomes even more serious when you learn that a very high percentage of pancreatic cancer patients experience fat malabsorption early in the disease, often long before they notice pain or weight loss. When a tumor blocks the pancreatic ducts, enzymes cannot reach your intestines and fat begins to accumulate in your stool. Some Americans describe this change as stool that floats or feels difficult to flush, which is one of the most recognizable signs of digestive enzyme failure. Even though stool changes may feel uncomfortable to talk about, they provide some of the clearest clues that something deeper is wrong. If you notice this pattern happening more than once, it is important to speak with a healthcare provider so they can evaluate your digestive function and pancreatic health. Early attention helps you understand what your body is truly experiencing. But even recognizing this sign is still not enough because the next symptom can appear suddenly and create risks that are far more serious than most people expect. Number 9, blood clots. One of the most surprising and dangerous warning signs you should never ignore is the sudden development of blood clots, especially when they appear in your legs without any clear cause. Many people first notice swelling warmth or a tight aching sensation in one leg and assume it is a muscle strain or something they slept on wrong. But blood clots form when the body's normal clotting system becomes disrupted. When cancer grows inside the body, it can release substances that make your blood clot more easily, and this creates a serious risk long before other symptoms appear. This warning becomes even more important when you learn that a significant number of pancreatic cancer patients experience blood clots early in the disease, sometimes before they notice any digestive issues or abdominal pain. These clots most often form in the deep veins of the leg and can travel to the lungs if not treated quickly. This condition is known as a pulmonary embolism, and it can become life-threatening within minutes. Because the symptoms can feel mild at first, many Americans dismiss them as everyday leg discomfort, losing precious time in the process. If you notice unexplained swelling, redness, or pain in one leg, or if the area feels unusually warm, it is important to contact a healthcare provider as soon as possible. Quick attention can prevent serious complications and help determine whether your pancreas may be involved. But even recognizing this sign is not enough because the next warning can appear directly on your skin and reveal changes you might never expect. Number 10, skin changes. One of the most overlooked yet revealing warning signs is unusual skin changes, especially when you notice persistent itching or rashes that appear without a clear reason. Most people try to explain these symptoms away as allergies, dry, weather, or irritation from clothing. But your skin can reflect what is happening deep inside your body. When the pancreas or bile duct is affected, bile can build up in the bloodstream, and that buildup often shows itself through itching or visible skin irritation. This kind of discomfort is not random. It is the body's way of signaling that something is disrupting its normal balance. This warning becomes even more important when you learn that a noticeable percentage of pancreatic cancer patients experience skin symptoms early in the disease, sometimes alongside jaundice or changes in liver function. When bilirubin rises or when inflammation increases inside the body, the skin becomes one of the first places where those internal changes appear. Some Americans describe persistent itching that keeps them awake at night or rashes that do not respond to usual creams or remedies. These symptoms can feel annoying, but they can also be a powerful clue that your body is reacting to something more serious. If you find yourself dealing with unexplained itching, unusual rashes, or changes in your skin tone, it is important to pay attention and get evaluated rather than hoping the symptoms disappear on their own. Early testing can give you answers and help you understand what your body's trying to communicate. But even recognizing this sign still is not enough because the next warning can appear in your abdomen and create discomfort that becomes impossible to ignore. Number 11, abdominal swelling. One of the most uncomfortable and easily misunderstood warning signs is persistent abdominal swelling, especially when your belly begins to look or feel larger without any clear reason. Many people assume this swelling must be related to gas, mild bloating, or something they ate. However, when the pancreas is under severe strain, fluid can begin to accumulate in the abdominal cavity. This condition, known as ascites, creates a tight or heavy feeling in your midsection and can make your clothes feel suddenly tighter around the waist. This is not normal bloating. It is a physical sign that something deeper inside your body may be shifting. This becomes even more concerning when you learn that a meaningful percentage of pancreatic cancer patients experience abdominal swelling in the more advanced stages of the disease, often before they realize how serious their symptoms truly are. When the cancer affects nearby organs or the lining of the abdomen, fluid begins to build up quietly, creating pressure that can make breathing uncomfortable or eating more difficult. Many Americans notice this swelling when they feel full after only a few bites or when they wake up with a belly that feels heavier than usual. These changes often go unnoticed at first, but over time they become a clear signal that deserves attention. If you find your abdomen swelling persistently, or if the sensation keeps returning, reaching out to a healthcare provider can help uncover what is happening inside your body. Early evaluation can prevent complications and provide answers when you need them most. But even understanding this symptom is still not enough because the next warning can show up during everyday meals and reveal a disruption that many people never expect. Number 12. Persistent indigestion or heartburn. One of the most easily dismissed yet highly revealing warning signs is persistent indigestion or heartburn, especially when it continues even after you change your diet or use common remedies. Many people in the United States experience indigestion from time to time and assume it is caused by spicy food eating too quickly or simple stress. However, when this discomfort becomes a daily pattern, it may indicate that your pancreas is struggling to support proper digestion. The pancreas produces key enzymes that help break down your meals, and when this process is interrupted, food can remain in the stomach longer, causing pressure acid buildup and a burning sensation that refuses to go away. This warning becomes even more important when you learn that a significant number of pancreatic cancer patients report digestive issues long before they receive a diagnosis, often describing a feeling of fullness after small meals or a constant burning in the chest. These sensations can be confusing because they mimic common digestive problems, which makes them easy to overlook. Yet when the pancreas or surrounding organs become affected, the entire digestive process slows down, creating discomfort that should never be ignored. Many Americans notice this during everyday activities, such as feeling uncomfortable while bending over or experiencing reflux after meals that never caused issues before. If you find that indigestion or heartburn keeps returning despite lifestyle changes, it is important to take that symptom seriously and speak with a healthcare provider to understand what your body is trying to tell you. Early awareness can make a meaningful difference in catching problems before they become more severe. But just knowing this sign alone is still not enough, because what truly matters now is how all these signals come together to protect your health. You have now seen the 12 warning signs that your body may use to signal trouble long before a serious problem becomes obvious. And understanding them gives you something incredibly powerful. It gives you the ability to act early, protect your health, and take control of your future. While each symptom may appear small on its own, together, they create a clear message that your body should never be ignored. This awareness is not meant to create fear. It is meant to give you clarity, confidence, and the reassurance that you can make smart decisions for your health starting today. If you notice any of these symptoms in yourself or someone you care about, the safest step is to speak with a healthcare professional, ask questions, and get the right tests. Early attention can change everything. You are not powerless. You are not alone. Your health is something you can influence every single day with awareness, action, and the willingness to listen to your body. Even small choices like staying hydrated, maintaining a balanced diet, and scheduling routine checkups can create long-term protection and peace of mind. Remember that your body is constantly working to protect you, and recognizing these signs is one of the most important ways you can protect it in return. You have the strength to take action, and you deserve the best chance at a healthy life, no matter your age or background. The next videos on this channel will guide you through practical steps, safe foods, and simple daily habits that support your pancreas, digestion, and overall well-being. If this video brought you clarity or helped you understand your symptoms, better save it so you can revisit these signs whenever you need to and share it with someone who may benefit from this knowledge. Make sure to subscribe to the channel so you never miss the latest medical insights, senior health tips, and life-saving guidance that can keep you strong, aware, and protected. Your health matters, and taking one small step today can create a healthier tomorrow.